Oh, no, he's going to. Oh, no. Oh, the commercials. Have you ever been watching your favorite movie and all of a sudden the commercials start to roll and you're just wondering when are they going to be over? There's something really big about to happen and I need to know what it is now. So you kind of really don't pay too much of the commercials. You might have a commercial about McDonald's. You might have one about Kohl's having a special. You never know. Mother's Day just passed. Father's Day is coming up soon. But then you hear one that says, have you or a loved one ever been diagnosed with mesothelioma? If so, contact the number below. So what do? You change the channel. You really don't pay too much attention to it. You're thinking, I'm going to watch a different movie right now until my show or my movie comes back on. Then I'll hop back. But in the back of your mind, you start to think, mesothelioma, what is that? In order for you to understand what mesothelioma is, you need to know three things. What it is, who it affects, and what treatments, if not, are available. Now, what is mesothelioma? What is it exactly? Mesothelioma is a form of lung cancer, that is caused by scarring in the lungs, which affects the cells in the lungs and pleural cavity, creating a mutation which transforms the cells into cancerous cells. According to asbestos.com, mesothelioma is a malignant tumor that is caused by inhaled asbestos fibers and forms in the lining of the lungs, abdomen, or heart. Now, it's very uncommon for somebody to be diagnosed with mesothelioma, just because the prognosis or the time it takes for the cancer to actually form can take from 20 to 60 years. That's a big range. You're wondering, if I inhale this now, me being 22, I could either have mesothelioma at the age of 42 or maybe even 82. There's a 40-year gap right there that I'm not going to know, hey, you're going to have cancer soon. Now, but what is asbestos? Asbestos is a fibrous crystal that was and is still found in some automatic transmission components, including clutches, brakes, and gaskets, to say a few. It is also found in fertilizers, soils, and construction material. Now, there are some symptoms and diagnostic tests that can be done in order to narrow or concretely determine if the patient actually has mesothelioma. Some of the diagnostic tests that can be done are image tests, which consist of MRIs, CT scans, or X-rays. Now, if a stain or a spot were to show up on those image testing, most likely that is proof of cancer, and a doctor could actually order a biopsy. Now, a biopsy is a small surgical procedure in which the surgeon, most likely, will enter the person's body and remove a sample of that affected area, whether it be tissue, organ, skin, or maybe even hair. Now, blood tests can also be done, but they're not really too helpful in determining. They're mainly used to monitor and keep track of the patient during treatment and during prognosis. Now, some of the symptoms that are commonly related to mesothelioma are dry coughing, shortness of breath, respiratory complications, pain in the chest or abdomen, fever or night sweats, pleural effusion, which is fluid in the lungs or in the cavity of the lungs, fatigue, and weakness of the muscles. Now, if you have one or two of these symptoms, most likely you don't have mesothelioma. You kind of need to have all of them. It's either you check all of them or you check none of them. So don't be worrying about it. But you never know. Maybe a loved one you know might have it. Now, to help answer that question, who could be affected by it? Who's at risk? Now, the next thing to know that the main factor is actually age. Ethnicity, like most other types of diseases or complications, is not related to it. Age is the main contributor because most of the cases are men over the age of 65. Now, there are times when there are people younger than 45, maybe even younger than 40, but it's very hard for those to show up. According to the American Cancer Society, about 2 out of 3 patients with mesothelioma are over the age of 65. Now, as I said, men over 65. There are women who could have mesothelioma, but it is mostly men, and that is because of the type of careers or jobs that are involved that expose that person to mesothelioma. Two of the main careers that expose people to mesothelioma are veterans and blue-collar workers. Now, blue-collar workers consist of firefighters, construction workers, power plant workers, shipyard workers, and as I said, veterans. U.S. Navy, U.S. Air Force, U.S. Marines. People that are mainly contributed to the construction or the functioning of certain vehicles that are used. Now, mesothelioma is a very fast-growing cancer. It spreads very rapidly, and it forms kind of like a spider web. Not Spider-Man. Not Spider-Man. It's for those Marvel fans. A spider web. And it kind of grows inside of those airways, and it blocks them. And it prevents the patient from actually being able to breathe. Tumors can grow along the esophagus, pushing against the person's trachea, esophagus, either on the neck or in the chest, preventing the person from even eating at times. Now, this all sounds kind of bad. Like, it sounds pretty bad. It kind of is. Now, are there any treatments or any cures for this? Well, there is no cure, unfortunately. They're still developing and researching different things that they can do in order to help these patients cure themselves of this disease. But there are treatments. Chemotherapy and immunotherapy. Chemotherapy is a drug that is introduced into the body to help slow the production or mutation of the cells. Immunotherapy is introducing kind of like a vaccine into the body in order to help the body fight the cancer off itself. Some of the procedures that are also done are people get, or surgeons recommend the patient get, a pneumonectomy or a pleuroectomy. Now, a pneumonectomy is the removal of a section or the entire lung. That's crazy. Or a pleuroectomy, which consists of removing the pleural cavity, which encloses around your lungs and your heart. Now, life expectancy for patients really isn't too high. People with stage 1 are given a life expectancy of more than 21 months. Stage 2, around 19 to 21 months. Stage 3, 16 to 19 months. And stage 4, 12 months to about 16 months. Now that you've been informed on what mesothelioma is, who it affects, and what treatments, if not, are available, you might be thinking of contacting a loved one who might have been exposed to it. You might be thinking of an older uncle, a grandparent, maybe even a friend you know or your neighbor. Now, why did I choose this? Why did I choose this disease? It's not because I like the commercial or the guy's deep tone in the commercial, but it's because I have a very personal connection to this. My father in September of 2012 was diagnosed with stage 4 mesothelioma, the most severe form of its cancer. In 2012, November 2013, he had a right pneumonectomy and a complete pleuroectomy. The cancer had spread very far into his right lung and it had to be removed, and some of the cancer was growing on his chest wall and pleural cavity, and thus the pleural cavity was removed and some scraping was done on his chest wall. But unfortunately, in October 27, 2014, all of my family were together. We were alongside him, waiting for him, and he was waiting for us. And at that moment, he took his last breath. My father passed away from mesothelioma. My father's life was prolonged due to the treatments and procedures that the hospital and doctors recommended. Now, research for a cure will not stop. It is growing every day. And more patients are coming out and showing that they are having proof of a longer life expectancy and possibly a cure to this. So now that you know what mesothelioma is, who it is, you can go back and watch your movie or your favorite show.